Hi everyone, welcome back to my YouTube channel, The Breast Cancer Physio. My name is Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this video today, I'm going to be teaching you how to resolve cording, which is a really common side effect after breast cancer treatment, specifically axillary lymph node dissection and sentinel node biopsy. Now, if you enjoy this content and you would like to see more, then please subscribe to my channel, which is completely free. Leave a comment in the section below because I would love to hear from you and find out what topics around breast cancer you'd like more information on, and give this video a big thumbs up. So without further ado, let's get into this video, how to resolve cording after breast cancer treatment. Firstly, what is cording? So interestingly, cording hasn't actually been defined in the medical literature, but it's my firm belief that cording is tight nerve tissue. The reason I believe this is because every time I successfully treat cording, it's done using neural mobilization stretches. I'll show you how that technique works in just a moment. But before we get into that, let's talk about what cording looks like and feels like when it does actually present. So what does cording look like? A lot of women come in and they have already diagnosed themselves with cording because they lift their arm up and in the area of their armpit they can see a thick cord-like structure. Now, sometimes women don't see the cord, they'll actually just feel a cord. And the length of that cord can vary between individuals. So sometimes people just have a cord in this section of their arm, and other times they can feel a cord in the entire length down their arm. There's also cases where women will experience cording, but they don't feel an entire line of tension. The tension may jump in sections. So you might feel some tension through the armpit, and then you might feel tension in the inside of the elbow, and then another section potentially even down into the wrist and the hand. There's also cases where cording can occur in the chest wall. So women may experience cording into the breast tissue or into the chest wall, like basically around the corner of the breast, or if you've had a mastectomy, down around the rib cage. So cording is quite variable between individuals. You might see it or you might feel it or both, but ultimately the best thing you can do to get a diagnosis of cording is go down to your local physiotherapist or occupational therapist who specialize in treating people after breast cancer. How is cording treated? The way we treat cording, as I mentioned before, is with neural mobilization stretches. So what does this involve? We basically need to be able to put a stretch on the nerve tissue, specifically the nerve tissue, rather than just the muscle or the skin. So often women will present and they've tried to resolve their cording by themselves by literally just starting to raise up their arm. So they'll literally just be doing movements where they're just lifting and lowering to try and get that cording to go away. The reason this doesn't work is because it's not putting a bias on the nerve tissue, and I'll show you what I mean by this. When we perform a neural mobilization stretch, we need to bias the nerve in this way. The first thing you want to do is to extend your elbow. This is one of the most important points of resolving cording. Once you've extended your elbow, then you can start to lift the arm. And once you're lifting, when you start to feel a pull on that cord at any point along the length of your arm, then you can add the last most important part of the stretch, which is to extend your wrist. So by extending your wrist, you are putting a bias on the entire length of the nerve running down your arm. So if your elbow is flexed or bent, you are not tensioning this section of the nerve. And this is where a lot of people don't resolve their cording. They don't remember to focus on extending through the elbow or straightening through the elbow. So once you're in this position, all we do is take the hand back and forward 30 times, twice a day in this fashion. And when we go from here to here, all we want to happen is that we want less tension on the cord and more tension on the cord. So once your hand is in a flat position in line with the rest of your arm, you should feel less of a pull. And then when you take your hand back, you should feel more of a pull. You may feel the cording pull the entire length of your arm. You may just feel it in your armpit. You may feel it in sections around your arm. Any of those sensations are totally fine, but ultimately we would just want to work that wrist back and forth and feel the pull coming on and off like a light switch coming on and off. Just a quick note, on the aftermath of these exercises. If you experienced a dull ache or a strong ache in your arm or the armpit for an extended period of time beyond doing those 30 waves back and forth, and when I say an extended time, something in the realm of, anywhere from an hour or more, I would stop doing those exercises and consult with your physiotherapist or occupational therapist who specializes in breast cancer. Now, can cording make noises? This is a really interesting side effect of treating cording. Cording will often make popping or snapping sounds even when it is in the process of releasing. So I often reassure my patients that this is quite normal, and it's actually a positive thing because it's a little bit like cracking your knuckles. If you get a crack when you twist your head or twist your back or crack your knuckles, that is usually stiffness releasing. I suspect in the aspect of cording, if you get a snapping or a popping sound, it's the same event occurring. It's just that tension letting go. So if you do these exercises and you feel or hear a snapping or a popping noise, don't be alarmed. This is completely normal. I often feel these pops when I'm doing a separate technique to treat cording, which is massaging through the cord itself, and it is not in any way a problem. I actually think it's a really good thing if you get that popping or snapping noise when you're massaging, or if you're doing your neural mobilization exercises. If that happens, don't worry, continue on, and you'll probably feel that the cord has actually let go to a large degree. So what do we do if this basic version of neural stretching doesn't actually work? In a separate video, I'm going to cover the more advanced technique of how we resolve stubborn cording. So if you have been doing these exercises at this basic level for a couple of weeks and you're not seeing any improvement whatsoever, there's an array of other exercises we can get you doing that will help progress that cording. One of the questions I often get asked is whether or not cording can restrict shoulder range of motion, and the answer is definitely yes. This is a really important reason to get down to your local physiotherapist or occupational therapist who specializes in breast cancer, because if cording is restricting your shoulder range of motion significantly, it can then impact things like how you fare during radiation treatment or how you fare just in everyday life. So when we go to radiation, the position of our arms has to be overhead, usually right up at the end of shoulder range of motion. So as you can imagine, if you've got bad cording and your arm is stuck here, it is really going to significantly impact your ability to get into a comfortable position during radiation. So definitely get cording treated as early as possible. Get into neural stretches. If you've got any questions about whether or not you think you have cording or not, please feel free to reach out to me. I am available one-on-one, either online or in person, to help diagnose cording. There's a lot of cases by which you think you might have cording, but it's actually something else going on. And it's really, really good to get a thorough diagnosis as to whether cording is actually present or not. Thank you so much for watching this video. I hope you found this information on cording really helpful. I release a new video every week around the topic of breast cancer, so please stay tuned for next week's video. If you'd like any more information on cording, then please leave a comment in the section below. If you've enjoyed this content, then please give this video a big thumbs up, subscribe to my channel, and I will see you for my next topic on breast cancer. Thank you so much for listening. I'm Jen McKenzie, the Breast Cancer Physio. See you next time.